welcome to the weekly COVID review. As usual, we will be broadcasting this on Facebook Live, and I'm also recording this and putting this up on a YouTube page. So I did set that up, and I will have last week's and this week's up probably in the next couple of days. And then from this point on, I will, after I record this, upload this onto Facebook right afterwards, so that those folks who can't attend this in person can access it on my YouTube page. Of course, you can also access this through Facebook Live. I believe Facebook keeps it up as well. So anyways, let's get started. There's a lot to cover. There's always lots to cover. I keep thinking that maybe there won't be as much news to cover, but yeah, that never happens. Okay. Just look at the global numbers. So it looks like globally we've tipped over and are starting to decline again. So after our late spring surge, which was actually the worst surge that we've had so far in the pandemic, it was far worse than the winter surge. Looks like things have settled down. Now, whether that's actually true or not is, well, there's some debate about that. Most of this last surge was driven by India, and the numbers out of India coming out right now are highly unreliable. So I think we are probably tipped over, but it's still a bit uncertain. The numbers are really uncertain. But there are still some troublesome spots around the world right now, and in places that we didn't really see high numbers before. So we'll go over that. So here's the map of COVID cases, and you can see that India remains the hotspot, along with Brazil and the US. The good news is that in the US, numbers are getting better, but Brazil and South America as a whole is still struggling mightily. There's also a few other hotspots that we haven't seen before. Thailand, Taiwan, which is really surprising, Japan. So we have some countries in East Asia that really got through the past few outbreaks pretty well, but are now, well, something happened. We'll talk about that a little bit. So here are our new cases. So you can see that India you're seeing them tip over and the numbers are declining. But again, I'm a little bit uncertain about those numbers, whether that decline is real or not. You can see that Brazil has plateaued at this high level, and it's now starting to see a little bit of an increase. US numbers continue to do well, and we'll talk about that. However, Argentina and Colombia are seeing surges, and Europe in general is doing much better right now. So the pandemic has shifted to Asia, and South America continues to really struggle with this pandemic. So you can see the numbers. India, you are seeing a weekly decline of 20%. I think some of that is real, but I don't know if the decline is as great as the numbers indicate. And I'll talk a little bit about my concerns about India in a second. You can see Brazil has seen a 5% increase. US continues to do well. We saw a 17% decline since last week. You can see Argentina, huge surge, 35% increase in new cases in Argentina. Colombia is at a plateau. France, Iran, Turkey, Germany, Russia, well, not Russia, but you can see that most of Europe is doing quite well. The numbers are starting to decline. Russia's seen a little bit of an increase. So really, like I said, it seems like the pandemic has shifted a bit. Europe and North America is doing well. East Asia has some issues. South Asia continues to have issues. Africa is doing okay, with some caveats. And South America is continuing to really struggle. So let's talk about India a little bit. I've been talking about India the last few weeks since they've experienced this horrific surge. This is the grim news coming out of India. Even though new cases seem to have tipped over and we're in a decline, we're not going to see deaths decline for a little while. Remember, deaths are a lagging indicator, and I think deaths will continue to rise. And this is exacerbated by the fact that deaths are probably underestimated coming out of India by, we don't know. Some estimate by a factor of 10. So that's pretty bad. Why do we know this? Is because a lot of deaths in India right now are just completely unreported. And even if they are reported, they haven't caught up. I've talked about this before. Establishing cause of death is complicated. It takes a long time to do well, even in countries like the US or Western Europe that have robust data systems. In a place like India, it's much more difficult. So reports like this and reports of crematoriums, just, informal crematoriums popping up, indicate that a lot of deaths are unreported. So this is the grim news. Bodies are washing ashore on the Ganges. The Ganges River is considered an extremely holy river, and typically Hindus will cremate the bodies on the shores of the Ganges and spread the remains in the river. A lot of families cannot afford to cremate their bodies anymore because of lack of fuel, because crematoriums are absolutely filled, and so this is the end result. So absolutely apocalyptic, really. This is exactly what a lot of us, I think, in the US that are conditioned to watch zombie movies consider an apocalyptic vision of a plague. And yes, this is what's actually happening in India. So really grim days in India. So you can see the cases. Yes, they tipped over officially. This is per million. However, deaths probably will continue to rise. Again, this is 3 per million per day. We think that this is a gross underestimate. That is probably closer to, we don't know, maybe, I don't think a 10-fold underestimate is out of the question. So we could be looking at 20 to 30 per million per day, which is really, really high. To exacerbate things, and this is something that we're not talking about too much, is this fungal, this candida, and this has been a problem in the U.S. as well. It's an antifungal resistant candida. Now, candida typically is a fungal infection. We typically don't have an issue fighting it off unless you're immunocompromised. This one, however, especially combined with COVID, can be particularly deadly. This is really becoming a problem in India as well in hospitals. So this is typically a nosocomial infection, meaning that it's hospital-acquired infections, but this is becoming a real issue in India as well. So something to keep an eye on. In fact, I'm really concerned about what kind of nosocomial infections are going to pop up after all of this. It is already a huge problem. Hospital-acquired infections is a big problem, even in the most advanced healthcare systems in the world. Now that healthcare systems have been overwhelmed, is this going to be a continuing problem in our hospitals? Has COVID really kind of increased the risk of antifungal resistant nosocomial infections? This is something that we're going to have to keep an eye on. One of the problems with India right now, as far as reporting, is that it seems like the infections, the outbreak in India is shifted from the wealthier states and urban areas into rural areas. Now, the problem with that is that rural areas are less equipped to deal with this. And they have less developed data systems. So we may be seeing a gross underestimate in the number of cases. We think that it's already underestimated, even the outbreaks in the cities, but in rural areas, it's going to be even more underestimated. There's less testing, there's less hospital systems. How many people are not even getting into the hospitals because they are overwhelmed? so this is why the numbers, yes, it looks like it's tipped over. It might have, but the number of cases coming out of India is really, really unreliable right now, because just the overwhelming nature, the overwhelming numbers of cases. Now, India does have a fairly robust public health system, but again, it's just the sheer numbers of people. It's probably just completely overwhelmed. And so the number of cases reported probably is an underestimate. And so, yeah, so that's my concern. So you can see that it has, previously, the hotspots were Gujarat and West Bengal. Now it's kind of shifted south and north. And those are more rural parts of particularly these northern provinces. It's a much more rural part and poorer part of India. So their healthcare system, their public health system isn't quite as robust. So that could result in underreporting. So India is still struggling. Even though it looks like it's going down, it is still struggling, and it's going to continue to struggle for the time being. They have ramped up their vaccination program, but remember, vaccination programs are not an immediate fix. You probably won't see the results of the vaccination program for 4 to 6 weeks. Even if they can magically vaccinate everyone in the country right now, you won't see declines for another 4 to 6 weeks. So that is so India remains a hotspot. Now, another concern about the Indian outbreak, I talked about how the Serum Institute, in fact, there was some news that just came out about the Serum Institute. So one of the, thunderstorm. One of the impacts of the outbreak in India is that a lot of the vaccines that were allocated to the COVAX program for low to middle income countries is now being reallocated for domestic use. So the Serum Institute is the largest pharmaceutical company in the world. They have the biggest capacity for developing and for producing vaccines. They had promised 2 billion doses for the world by the end of the year, 2 billion. So that's a huge amount. They have since downgraded that because of the domestic needs. So that's going to have an impact all over the world. The COVAX program is really at a standstill, and vaccination of low to middle income countries has really, the vaccination rates have gone down considerably. Even with the Chinese vaccines, it's just not enough. The other problem, of course, with the India outbreak is the neighboring countries. And you can see Nepal has seen a huge spike from a per capita standpoint, even greater than India, because of the porous border between India and Nepal. There's a lot of movement across that border. So it was very predictable that India would see a surge, and they have. And India and Nepal would see a surge, and they have. Nepal, of course, is even less equipped than India to deal with this. Their healthcare system was quickly overwhelmed. And so you've seen some really high numbers in Nepal as well. Sri Lanka, you're seeing a huge increase as well. Sri Lanka is, of course, separated by some water, but still, there's a lot of movement across between Sri Lanka and India. There's also concerns about Bhutan. Now, actually, Bhutan, I'll get back to in a second. Pakistan, you're seeing less of an increase, but the numbers out of Pakistan are not quite as reliable. And the border across, India and Pakistan is less porous. It's a much more controlled border just because of the animosity between those two countries. So you're not seeing as much of a problem there. Same with Bangladesh. Again, it's a fairly tightly controlled border. Myanmar, I did not include Myanmar or Burma here because the numbers out of Burma are completely unreliable. This is what happens when you have a military coup. I don't think COVID reporting is going to be really a priority. But news out of Myanmar indicates that they are seeing a surge there as well. The other problem with this region is the high degree of refugee movement, particularly on the eastern side of India, between India and, of course, Myanmar, because of the situation in Myanmar. anytime you have refugee movement or movement of populations, it's just going to exacerbate the pandemic. In fact, I want to cover that a little bit more because we are coming to a season where you're going to see a huge increase in refugee movement, in movement of peoples across borders. So from a per million, so from a per capita standpoint, Eastern Europe was kind of leading the way, but that's since shifted to South Asia as well as South America. You can see how bad things are in Argentina right now, and they are really, really bad. So the Seychelles and Maldives, I did include it. We talked about this last week. They're huge surges. And of course, that was a concern because those two countries have some of the highest rates of vaccination in the world. Seychelles actually has a higher percentage of their population vaccinated than Israel, and yet they saw this huge horrific surge. And so I think the takeaway message is that vaccination campaigns are not enough. And especially when you're vaccinating with potentially less effective vaccines. Seychelles and Maldives, the bulk of their vaccination was with the Sinovac and Sinopharm vaccines, which don't have as high an efficacy. In fact, the efficacy for Sinovac, I believe, is less than 50%. So that combined with opening up the economy, allowing visitors, removing restrictions, it's not a great formula. Okay, so vaccines by themselves are not going to make an immediate impact. Of course, long-term vaccines are going to, and that's going to be the way out of this pandemic, is to vaccinate as many people as possible. But in the short term, you might see situations like this, especially with less effective vaccines. And Bahrain's the same issue, okay? But you can see the South American countries are really struggling right now, and they're not getting better. In fact, Argentina and Uruguay are seeing some surges. Brazil is seeing increases. Colombia is seeing an increase. Again, Sweden's up here. Boy, Sweden's just struggled. So from a per million standpoint, you can see at least Seychelles is reporting a decline finally. Maldives is actually increasing still. This is also islands, small islands. On one hand, it's easy to keep the virus out, but once it gets in, it can spread very, very, very quickly. Okay, we saw this in the Caribbean earlier on in the pandemic. We're seeing this in the Seychelles and Maldives. These are, of course, very small islands. And I know the Maldives especially, several islands, but most of the population is concentrated on one, and it can spread very, very rapidly, especially when you open up the economy. Now, remember, these countries are almost entirely reliant on tourism. So, you can't blame them for trying to get their economy going, but at the same time, this is the cost. And this is the unfortunate decisions that a lot of these countries are facing: economic ruin versus COVID. South America, to a degree, also has that same unfortunate decision they have to make. Then you have Bahrain, Uruguay, Argentina, Costa Rica, Lithuania seeing some declines, as well as Sweden. But the fact that Sweden's up here with these countries does not reflect very well on Sweden's approach to COVID. Paraguay is kind of steady. Colombia is kind of at a stasis. But again, this just kind of indicates how bad things are in South America right now. And they're continuing to get worse. So you can see this is per million, cases per day per million. South America has by far the highest per capita rate of COVID by continent, by far. I mean, Europe is next at about 100, then Asia, North America at about 80, 70, 80 or so. So we're talking about a threefold difference here. It's bad right now in South America. It just continues. In Argentina in particular, earlier on in the pandemic, it's horrific numbers. And it's actually, this is probably going to be the worst surge yet. I mean, it's bad. It's really, really bad. Argentina has ordered another lockdown. Boy, this is a country that just cannot afford that. Argentina was struggling economically before the pandemic, and this has just completely gutted their economy. And I don't know how effective this will be, given that so many people in Argentina are reliant on the informal economy. It's really is either I work or we starve. So they're just continuing to struggle. This is going to have reverberations for years after the pandemic is over, whatever that means. It's going to have reverberations. It's just really, South America has seen some really great advances in recent years with the growing middle class, shrinking economic wealth disparities, but this is just going to exacerbate all that. And we may see a lot more class conflict in South America in the coming years. We're already seeing that in Colombia. Colombia is racked by huge protests, a huge social movement. Will FARC come back? Will you see a return to the civil war that Colombia seemed to have emerged out of? I don't know, but it is a concern. So you can see Uruguay, they had that horrific peak, looked like things were getting better, but they're seeing another surge. Argentina, again, looked like things were getting better, another surge. Paraguay, Colombia, Brazil is still at that high level. They can't get their numbers down. Chile is doing okay, not as bad as some of the other countries, and that may be because Chile really has emphasized vaccination. They're the country that has by far the greatest percentage of population vaccinated in South America. And even if it is with less effective Chinese vaccines, it's still something. So they're not suffering quite as bit. Peru, I don't know how, they seem to be doing better as of late, but I don't know how reliable the Peruvian numbers are. So remember, a lot of these countries have their testing infrastructure still isn't great. So again, these are probably underestimates. Huge, in some cases, huge underestimates. Now let's talk about some other regions of the world that are having trouble. Japan. Japan, I suspect, and the Institute of Health Metrics and Evaluation out of University of Washington, I covered their report last week, the last few weeks. They try to model exactly by how much countries underestimated the number of COVID deaths. And so it was a lot of stuff that we knew was happening, but they put a number to it. So for example, in the US, we've officially reported about 580,000 deaths from COVID. This new report estimates that our deaths should be closer to 1 million deaths. So about a 1.8-fold underestimate, roughly. And a lot of countries in Europe and in Asia underestimates about a similar degree. The countries that seem to underestimate the most, so Egypt, for example, I believe there was like a 20-fold difference between reported and what we suspect has actually happened. They typically a combination of poor data systems. So again, not a robust healthcare, public health data system. I know that's really nerdy, but these things are important. And combine that with a authoritarian form of government that is not necessarily going to be forthcoming about COVID deaths. But Japan, they underestimated tenfold. They've reported officially about 1,000 deaths. This report estimates that they actually have more than 10,000 deaths. So that makes no sense. Japan has a very robust healthcare system. They supposedly have a very good, a democratic government. So it just seems to make no sense. Or maybe it does. The Olympics have been a big deal in Japan. They already canceled it last year. and they seem intent on having it this year, come hell or high water. There's no indications that they're even preparing to cancel it. They are going full in. Yet, this is the problem. Japan, their healthcare system is really, it's just stressed out to the max. They have a very good healthcare system. But here are the cases. You can see that they're going through, they saw a surge over the winter and they're going through another huge surge. 6,000 cases per day. That doesn't seem like a lot, but comparatively speaking, where they were at, this is extremely high. Again, this is probably an underestimate because the Japanese health testing regimen has never been very good. They've never done a lot of testing. I think Japan just suffered a lot from just complacency. Because they had such low numbers, they just kind of got very complacent about it. They have a decent contact tracing program, but their testing regimen's never been good. And there seems to be no urgency to vaccinate. And this is actually a problem with a lot of East Asian countries that have done really well controlling their numbers. Because of that, there's no urgency to get vaccinated, not like in countries that are seeing surges. There's no urgency at all. In South Korea, my parents just got vaccinated. They're over 65. They would have been in the US, they would have been vaccinated months ago. They just got vaccinated. So so the story in Japan, though, yes, those numbers don't seem to be horrible, but the deaths are much higher. Now, case fatality in Japan is higher because Japan is a much older country. I haven't seen their demographics, but I believe almost a third of their country is now over the age of 65. This is probably the country with the most lopsided population pyramid in the world. This is a country that has extremely low birth rates, extremely high life expectancies. So you have a country that is predominantly elderly. And so, yeah, this is of course, the populations that are most at risk. So they're most likely to go so deaths from COVID is a much bigger problem in Japan than, say, in other countries that are much younger. Their hospitals are completely overwhelmed. There are people being denied beds in hospitals, even though clinically they should be in a hospital, and they're dying at home. And so this is the situation Japan is in. Meanwhile, we have the Olympics slated to start. I know the US teams have basically said we are not going to. A lot of the teams would go over to Japan to start training to get used to Japan, get over the jet lag to prepare for the Olympics. The US team is not doing that. A lot of national teams have said they will not go to Japan to train. But all indications, I believe there was a news story a couple of days ago that the head of the Japanese Olympic Committee has basically said, no, we're having it. They're being very stubborn about this. Meanwhile, the Japanese nursing union and their hospitals and the Japanese citizenry have flat out said, we do not want the Olympics. So they're going to have trouble finding volunteers. I don't know how they're going to do this. It's going to be an utter shit show. It really is. Taiwan. Let's talk about Taiwan. So Taiwan had one of the most positive stories. They have really done well keeping out COVID from their island country. And because they're an island, because really the only way to get onto the island are ships and planes, they had a very, very tight quarantine system. And all the cases in Taiwan that were reported are typically travelers coming in, and they were immediately quarantined. They have recently seen a surge, and they're getting community spread, which is highly unusual for Taiwan. Now, 180 per day doesn't seem like a lot, and it isn't. But again, relatively speaking, they're used to zero. This is a huge surge. And this also indicates community spread, which is highly concerning. And that line, again, is going straight up. Now, what's going on? again, complacency. Because Taiwan's had so few cases, they've kind of let their testing has declined. Their contact tracing has declined. They were just completely reliant on their very thin wall of basically their quarantine system for travelers. However, recently, airlines have complained to Taiwan that because if airline crews had to stay in the country for any period of time, they had to quarantine for 2 weeks. That became really, really problematic for the airlines. And so the Taiwanese agreed to shorten that quarantine for 3 days. That's all it took. That's all it took. Then a lot of airline crews and travelers like to go to these what's called hostess bars, essentially just bars where, just you can go and socialize folks. And there's a little bit of a stigma around that. So if you go there and you start getting symptoms, you may not report that to contact tracers. This has been the epicenter of the Taiwanese outbreak. So again, they got complacent so that there was only one barrier between a COVID surge, and you got to have, they used to have a really good overlapping system. They had testing, they had contact tracing, really robust contact tracing, and their travel restrictions. They removed the travel restrictions, and they removed the contact tracing, they removed the testing. All they had was their travel restrictions. They reduced that slightly, and then boom. This is, again, textbook case of complacency and diseases just taking advantage of even the smallest weakness in the armor. Start an outbreak. And of course, combine that with the fact that, again, because of the complacency, there's just no urgency to vaccinate. Japan and Taiwan have abysmal vaccination rates. They got started late, and even then, they just haven't been ramping up. Japan, I just don't understand. They were planning on having the Olympics. Why didn't they get enough vaccines and start a vaccination program immediately? It just boggles the mind. I don't know. And these are wealthy countries. These aren't countries that can't afford the vaccine. I don't know. I would not count on watching the Olympics this summer. I just don't see how they're going to be able to do this. I see a lot of countries just flat out refusing to send their athletes. Thailand has also seen an increase. Again, driven by, Thailand's been doing well, but for them, it's record number of cases in prisons. Taiwanese prisons are very tight. Any prison system is just a hotspot. We had serious problems with COVID in our prison systems. And so you have COVID cases growing in Thailand because of the outbreak in prisons. So these are countries that, again, have done a great job so far, but you can only do it for so long. People get tired of it. You can't have these restrictions forever. That's why the vaccination is going to be so important. And yeah, vaccines are going to be the ultimate way out of this pandemic. And because we've had such a slow rollout in so many countries, yeah, you can only do strict lockdowns, social distancing for so long before COVID will find a way in. So here's Thailand. They went from close to zero to now 4,000 cases a day. So this is actually quite concerning to see countries that have been doing really well seeing these significant surges. Okay, I think big part of it is that these countries just really did not have the urgency to vaccinate. And hopefully this really emphasizes how important vaccination is. I do want to mention Gaza. The war in Israel against the Palestinians. Gaza's healthcare system is just was not great to start with, and it's worse now, of course. The rocket attacks have destroyed several hospitals, killed many doctors and healthcare personnel. It's created a lot of course, obviously created a lot of population movement. It's hard to isolate in homes when there's rockets flying, bombs blowing up. We're probably going to see a surge in the Palestinian occupied territories. It probably won't bleed into the Israeli population because the Israeli population is mostly vaccinated. So actually, this will actually be interesting to see if we see a surge in Israel. But we're definitely going to see a surge in Palestine because the vaccination rates weren't nearly as high as in Israel, and honestly, the Palestinians got the worst of this war. So I wanted to highlight that because this is going to be anytime you have mass population movement, refugee movement, you're going to have huge surges in COVID. So here are the numbers in Israel. Israel, again, is down at, they're close to zero. They are in a post-COVID their economy is completely open. And my guess is that they're going to remain really, really low. If they see a surge, it's going to be very, very small because of the level of vaccination. And most of the vaccine that they've used primarily is the Pfizer vaccine, so really highly effective. Palestine, you can see that they actually have some low numbers. Will they continue to go down? I don't know. I don't think so. You're probably going to see a surge in Palestine because of this war. Just any sort of conflict, any sort of population displacement combined with the pandemic is just a recipe for disaster. Which leads me to this next report. So this is the, the Internal Displacement Monitoring Center. And they just came out with their 2020 report. Even though we thought we were all shut down because of the COVID pandemic, we really weren't. There was mass movements of populations, really focused around South America, particularly Colombia, along with parts of Africa, of course, Syria, Afghanistan, Myanmar. There was mass movements of people. Again, anytime you have mass movements of people, combine that with a global infectious disease pandemic, it's a recipe for disaster. So actually, hold on one second. I think I had some quotes from that, but I guess not. So just to, and of course, I mentioned this because we're getting into a season. It seems like war is like any other natural phenomenon. It's seasonal, and we just start killing each other. We can't stop killing each other, it seems. I know that seems to be, it's really depressing, but it's true. So we have conflicts. I mentioned Colombia is having some, just a lot of social upheaval in Colombia. They have a very, very tenuous peace with FARC, with their, will we see a flare up of the civil war? It's hard to say. Africa, there's a lot of conflict in Africa. So a lot of population displacement there. Syria is still unstable. We saw what's going on in Israel. You have Afghanistan. You have Russian troops massing along the Ukrainian border. Myanmar and their military coup and the mass genocides that's happening. We know in Western China that there's a lot of repression there. We just don't know what's happening there. So we have conflict happening, but at the same time, we also have climate induced displacement. We're starting up hurricane season. We've already had a huge typhoon that hit India. We have hurricane season starting up in the US. We have typhoon season now starting up in South Asia. We have wildfire season starting up here, exacerbated by, the huge mega drought. Combine that with a pandemic, and we're going to have some issues. What I'm really concerned about, quite honestly, is hurricane season. indications are we're going to have the hurricane seasons have been getting worse and worse. We have way more Category 5 storms. And it really can impact the southern part of the US. Guess which part of the country has the worst vaccination rates? The places that are going to be most affected by the hurricanes: Alabama, Mississippi, Georgia, the Carolinas. So I'm really concerned about that. Wildfire season is coming up in the West. California at least has really good vaccination numbers, but Idaho and Wyoming have some of the worst. So, these are the things that keep me up at night. Yes, thank you, Deja. Yeah, Colombia is really, it's a complex situation. And then I forgot to mention Venezuela, of course. It's a lot of refugee traffic from Venezuela into Colombia. It's a very complex situation. Excuse me. Okay, so just wanted to mention that, something to keep an eye out on. As we have both natural disasters, man-made disasters, and anytime you have mass displacement of populations, you're just going to have exacerbations of COVID. These are week-by-week changes in the numbers. For the most part, good news. Globally, Europe's doing much better. North America is doing much better. Most of Africa still looks like the numbers are doing okay. I do have a caveat to that, but South America is continuing to struggle. And then countries that were doing okay are starting to struggle: Taiwan, Thailand. So Japan, something to keep an eye on. And these are the biggest changes in the world. Maldives saw a surge. Argentina, their huge surge. Bahrain, Uruguay. So again, you see those countries, some countries that we haven't seen before showing up on this list. Deaths. Let's talk about deaths. So this corresponds to what we're talking about with that Institute of Health Metrics and Evaluation report. Now, WHO is recognizing that we're probably 2 to 3 times more, the actual deaths are 2 to 3 times more than official records globally, locally even more. So anytime we see these numbers, multiply them by 2 to 3, possibly more. So it looks like we've kind of tipped over and deaths are starting to decline again. But we'll see with the surge in some of these other countries. Right now, deaths are really concentrated in India, Brazil, South America. US numbers are getting better. European numbers are getting much better. And you can see India, the deaths will probably continue to rise. Brazil saw a decline, but now seeing an increase. So I would expect deaths to increase in just about every South American country for the time being in response to surge. That's, remember, lagging indicator. India has the highest number of deaths counts at 4,000 deaths. Again, that's probably underestimated, maybe not even 2 to 3, maybe tenfold. Yeah. Brazil as well, although Brazil has actually, according to that report, Brazil has actually done a better job of reporting accurate death numbers, which is kind of surprising, actually. US continues to do well. We're now at about 570 deaths per day and declining. Colombia's is increasing, Argentina increasing. Russia's seeing a bit of a surge. Russian number, again, not terribly reliable, authoritarian government, so it's hard to see. It's hard to know with Russia. Peru, Iran, it's good news out of Iran. They've seen a decline. Ukraine as well, and Turkey. Turkey, of course, saw that huge surge. Now they're finally starting to decline. It seems that their shutdown really worked. As far as per million, it used to be Eastern Europe that really dominated this, but it's now South America, particularly Argentina. So you can see, again, all the Uruguay, Paraguay, Argentina, Colombia, Peru, Brazil, all seeing increases. Chile, not so much, but yeah. And of course, Maldives And Seychelles is going to see big increases as well as Nepal because of their surge. So these are the top countries. Uruguay is number one, Paraguay, Argentina, and it's going up. Seychelles was actually zero before this last week. That's why there's no increase in percentage. They're now seeing 10 per million. So that's as a result of their huge surge. Colombia is seeing an increase, Peru, Brazil. So yeah, and then Nepal, an 80% increase in deaths, again, because of their surge. And you can see where there's increases. Again, Myanmar, that's the numbers there are really, really unreliable. Sri Lanka, Nepal. Bhutan seems to be doing okay so far. Now, Bhutan's an interesting case, very poor Himalayan country. They have an extremely high vaccination rate. They seem to be being spared the worst of this. Okay, again, South America is doing quite poorly. The caveat, so as far as deaths per million, you can see Seychelles, Maldives kind of lead the way. Then Nepal, Suriname has seen a surge. This is actually changes, not per capita, excuse me. Bahrain has seen an increase. Jamaica has seen an increase. So again, we seem to have shifted more towards the Western Hemisphere, particularly South America. Now, here's a caveat about Africa. This is a study that came out of Lancet looking at mortality in Africa. So these are among hospitalized African patients. The takeaway from this, and this is something that we all kind of suspected, but this gives us some evidence, outcomes for serious COVID in Africa are far worse. And that makes sense. They just don't have the clinical facilities that we have in the West. Clinical facilities are extremely expensive. Ventilators are extremely expensive. They just don't have that in Africa. Now, the reason why I put this here is because the potential for high number of deaths and a huge amount of suffering if COVID numbers take off in Africa. So far, they haven't. But if we do have a situation like India, it would be absolutely horrific in Africa. They just don't have the clinical facilities to take care of severe disease there. The outcomes are far poor. They have a lot less resources. Takeaway here is that so far they've done a great job because they've realized that public health is the cheapest way to keep out of, to keep the numbers low. And they've done a phenomenal job, contact tracing, social isolation, the basics that, quite honestly, the Western world has done really poorly. They've done extremely well, but it just takes a little bit, just a little complacency for it to explode. We're seeing this in Taiwan, in Japan, in Thailand. We're seeing that right now in those countries. We need to make sure we vaccinate as many people as we can. We need to really double, triple, quadruple the efforts to vaccinate the rest of the world. Otherwise, this is a disease that just takes advantage of if we just relax even a little bit, it just explodes. Let's talk about global vaccines. About 1.5 billion people, doses, excuse me, 1.5 billion doses. So, yeah, I mean, this is getting steeper. That's a good sign. US is leading the way as far as countries are, and then India, in terms of just the number of doses. Again, India, just remember, India has 1.3 billion people. So they still need to really ramp up, they need to really ramp up their vaccination program. Then the UK, Brazil, Germany, France. So as far as the number of people, about 700, a little more than 700 million people in the world today. The US, about 150 million. Then India, then Brazil, UK, Germany. Again, a lot of wealthy countries, but a few low to middle income countries that are on this list. So as far as per million people, Seychelles, again, highest rate of vaccination in the world, yet they saw a huge surge. Okay, Then Israel, UAE, Bahrain, again, huge surge, but they have a lot of folks vaccinated. Chile, the same. UK, the Maldives, and then the US. The Western European countries are starting to catch up. That's good news because they had a really late start. So you got Germany, Italy, France are really starting to catch up. China, Brazil, and India still have a long ways to go. Long ways to go. And this is on a map. You can see, again, North America, West Europe are the highest levels of vaccine. Africa is really, really just, they're still waiting for vaccines. Yeah. As far as rate of vaccination, number of vaccines per day per million, or per 100, excuse me. Uruguay leads the way. They're really, really vaccinating rapidly. Then Qatar, Dominican Republic has just shown up. So they seem to really gotten their vaccination together. Not quite sure what vaccine they're using. I need to find that out. They just popped up on this list. Canada's starting to get their act together. They're starting to vaccinate a little bit more. I know they've struggled to vaccinate. They've got a late start, kind of along with the rest of Europe, but they're starting to really vaccinate more. Then China, Kuwait. We are now further down here. Our vaccine rates have slowed down quite a bit. Brazil and then India. India still, they need to really ramp up as fast as they can. But vaccinating 1.3 billion people in this is not easy. As far as shares of people who received one dose, again, Mongolia is interesting. They've really ramped up their vaccine. So again, it's a lot tougher to vaccinate if you are a low middle income country. However, there are some countries that have done this really, really well. Mongolia is one of them, Chile, Uruguay, Bhutan I mentioned. So these are countries that have really robust healthcare systems, public health systems, and they really prioritize vaccines. The unfortunate aspect of this is that they're probably vaccinating with less effective vaccines. But at least they have vaccines. At least China is providing that. I know a lot of people say, well, Chinese vaccines aren't as good. They're just using it for political purposes. You know what? From a public health standpoint, I don't care. I really don't. I'll let the politicians worry about that. The Chinese vaccines so far seem to be, they're not as effective, but they do work. It's better than nothing. So as far as number of people vaccinated, US has the largest number of people vaccinated. Then India, Brazil, UK, Germany. So US is leading the way, which we should be because, we're the wealthiest. As far as percentages, though, Seychelles is number one, which again, that just made it so shocking that they had this huge surge. By the way, a third of that surge were people who were supposedly fully vaccinated, 2 doses. But again, if you have a 50% efficacy, that means half the people who get vaccinated, they're not protected. But my guess is, and the data isn't out yet, those folks who did get vaccinated and were breakthrough infections, chances are they had much less severity. So, remember, vaccines, even if they're still successful, even if you actually contract COVID, they're still successful if it keeps people from dying, keeps people out of the hospital. It keeps the symptoms, less severe. It's still a success. And by all indications, that's the case. Again, I would like to see those numbers coming out of Seychelles, out of all those breakthrough infections. Israel is second. Like I mentioned, Israel is now looking at they've pretty much opened up everything. And they're still continuing to vaccinate. Then Maldives, UK, good news coming out of the UK. They're vaccine mixing and vaccine, prioritize first dose, wait on the second dose. Campaign seems to be effective. In fact, a study came out of the UK saying that if you delay the second dose of the mRNA vaccines beyond the 1 month, it actually increases efficacy. I need to take a look at that data, but that's actually really interesting. There are mixed vaccine trials. They're starting to report data out of it, mostly safety data. The safety data so far is good. It looks like mixing the vaccine, say AstraZeneca with Pfizer, actually increases the severity of side effects slightly, but not to a significant degree. I personally did not experience that, but that's just an N of one, so I'm not going to really dwell on that. Yes, I did mix vaccines because I don't know, well, it's because AstraZeneca. I mean, I had the AstraZeneca off the clinical trials. I had no idea what that meant legally if I was fully vaccinated or not. So I got a Pfizer chaser, and I'm okay, at least physically. At least, maybe, I don't know. Maybe, one of the theories about vaccine mixing is because you have vaccines from very different mechanisms, that it might actually enhance immune response. That's an interesting theory. Immunologically, it makes sense. We'll see if that actually results in more efficacy when the results of that trials come out. Okay, only the safety data has been released so far. Anyways, so far UK numbers seem to be doing okay. As far as vaccines administered by continent, Asia is starting to increase because of the Indian vaccination campaign, but really North America and Europe are really dominating. And this is the tragedy of this. Africa, barely vaccinated, any of Africa or South America. And then, of course, by income group. So these are high income, upper middle income, lower income countries. Okay, so these are, you can see that high and upper middle are dominating, and we basically vaccinated no poor folks in the world. Yeah, and this is the problem right now. The justice issues are just, they're just basically punching us in the face. As far as the countries with that have the highest levels of vaccination with highly effective vaccines, US, UK, and Israel, again, the numbers look really good, particularly in the UK and Israel. And the US numbers are continuing to decline. Hopefully they continue to decline more. We'll have to see. I do have concerns about US numbers. I'll go over those when we talk about US numbers. And then this is deaths. So again, UK and Israel, their deaths from COVID are almost zero. So really good news. US deaths are starting to decline. And the R naught, again, you get Israel's R naught, they're down to 0.5, which means that, every infected person is infecting another half a person. So 2 infected people, we're only infecting 1 person. So again, every generation of disease, the number of people infected is cut in half. It's great news. The US is about 0.8, so that's really good news as well. The UK is hovering right around 1, so they're at kind of, I think, they're doing fine, I think. This is the most recent data on vaccine hesitancy. Now, I put this down just to let you know that the US is the only country that has hesitancy issues. In fact, the US isn't even the worst. France is, which is a little bit surprising. But the anti-vax movement it's very active in places like Australia and France, as you can see. So France has got some real issues as far as hesitancy. But even countries like South Korea. Now, this is the problem with stereotypes. A lot of people say, well, hey, Asia, they're much more communitarian. They're more likely to take the vaccine. No, not really. That might also be exacerbated by the fact that South Korean numbers got really, really low. So again, there's not that urgency. It's hard to say. So the UK actually has some really good numbers as far as hesitancy. If they can vaccinate these 2 groups right here, the vaccinated, the unvaccinated willing to get vaccinated, they could achieve herd immunity potentially. Canada has okay numbers, but we've exported a lot of our anti-vax movement to Canada as well. So yeah, this is not just a problem of the US. This is a problem all over the world. This this here is actually, a lot of that is exacerbated by political issues that are somewhat unique to the US. But in a lot of these countries, the anti-vax movement has been kind of embraced by more right-wing political groups. So again, something that we need to keep an eye on. So that's global numbers. So overall, good news, most of the world. India is still really, really struggling. South America is really, really, really struggling. And there's a few hotspots that are, maybe not contributing a lot to global numbers, but are concerning because these are countries that almost had 0 cases and now are seeing huge surges. Taiwan, Japan, Thailand, a few others. Any questions so far with that before I move on? Okay. Let's talk about the US. US overall, really good. I mean, just good news overall so far. Numbers continue to decline. In fact, in the number of cases here, oops, sorry. The last time we saw that, oh, shoot. Here we go. What did I don't know what happened. Sorry. Last time we saw these numbers, about, we're looking at about 28,933. Last time we saw that was June 23rd of last year. So really good news. So we're past, we've gone past this little surge here. We're now getting down to the numbers we saw back here. Okay, before that first summer surge. So really good news. And they continue to trend downward. And I don't see this changing anytime soon. So good news. The hotspots, there aren't really any huge hotspots right now. It looks like West Virginia's a bit of a hotspot here. Michigan is still continuing to recover, but their per capita numbers are still high, but they are recovering from a serious surge. Same with Minnesota. Colorado is starting to decline from their surge, the Pacific Northwest as well. So that's kind of the hotspots. The rest of the country is doing okay. Dade County, by the way, is seeing a little bit of a surge in Florida, which is a concern for as far as urban areas. So Florida, if Florida's number one in counts, about 28,000. The per capita is not horrible, and they're seeing decline. So overall, it's okay. They're doing okay. The concern with Florida is that there's a lot of travel to Florida, and you have a governor that is not, how do I put it nicely? Not the most COVID. He doesn't prioritize COVID so much. So I'm always concerned about those states. Texas is second, another state that is maybe COVID is not as big of a deal for them. New York, Michigan, and so on. So as far as per capita, Michigan still remains number one. Maine had a bit of a surge, but they're seeing declines now. So, and Maine has the advantage of, their vaccine numbers are awesome. So they're in a decline. Colorado is starting to decline as well. They had a surge. They're starting to see declines. Wyoming has seen a bit of an increase. Now, I do get concerned about Wyoming and Idaho because their vaccine numbers are atrocious, and they probably will remain atrocious forever, maybe. So yeah, so that's a concern. Anytime I see little surges like this in states that have very low vaccine numbers, I get concerned. So anyways, they're not huge. It's not a huge, if you look on the graph, it's like little blips, but something to keep an eye on. Okay. On the other end, California continues to do remarkably well, 3 per 100,000. I mean, that's phenomenal. And they're still declining. Oklahoma's doing well, Nebraska, South Dakota. So this is interesting. It's a nice little mix here of Democratic states and Republican states. Okay, so you got South Dakota with one of the governors that to me has done one of the worst jobs with COVID, along with California, which has done one of the best jobs. So We'll see. We'll see if that sustains itself. Okay, as far as changes, like I mentioned, Wyoming has seen this change. Idaho's seen a little bit of an increase, not too much, 6% is not a lot. But again, those two are states that also have very, very low vaccination rates. If we see a surge, and there may be a surge in the summer, and some epidemiologists are predicting that, the states that are going to get hit are the ones with the lowest vaccination rates. Probably Wyoming, probably Idaho, probably the South. Those are the states that have the biggest issues with vaccination right now. Now I'll get to that in a second. But overall, though, I mean, with the exception of those 3 states that have seen 2-week changes, rest of the states have seen decline. So just in the US, the numbers continue to trend positively. Deaths also, we're seeing continuous declines. And I don't see, even when if we have surges, I don't see a surge in those numbers because our vaccination rates among those over the age of 65 are good. Even in states with low vaccination rates, over 65 vaccination rates are really, really good. Okay. The state with the lowest levels of over 65 vaccination is like, it's still at like 75%. So that's really good. So I don't see deaths increasing because number one, most of the at-risk population is vaccinated, and in fact, vaccines prevent serious disease and deaths at an extraordinarily high level. So I don't see that changing. As far as deaths, the number of deaths, raw deaths, Florida is number 1. Michigan is actually number 2, even though Michigan has a higher per capita rate. Florida, just because there's a lot, it's an older population, plus they just have more people than Texas, Pennsylvania, Illinois. California still has a relatively high number of deaths, comparatively speaking, just because of the size of the population. But still, if you look at their per 100,000, it's very, very low. And this is by mortality rate per capita. Michigan is still number 1 because of the surge that they've had, but it is going down significantly. Kentucky is number 2, even though they have a low per capita rate of cases, which is a little concerning, actually. Then Alaska, Pennsylvania, Florida. So overall, the U.S. numbers continue to do well. Here's some individual states that we've been following. Michigan has almost recovered from their surge. You can see how bad things were in Michigan. Their early spring surge was worse than their winter surge. So it was bad. Florida is now recovering from their little mini surge. Things are getting better. Again, there's a little bit of a hotspot in Dade County, but overall, the state numbers continue to do good. Also notice the deaths. Yes, in Michigan, there was, even though they had, their number of cases was much higher, their deaths were much lower because this surge was driven mostly by young people. Okay, so, and I shared that data with you before about how the hospitalizations during this last surge in Michigan were dominated by the younger populations. So this is why I say I don't see us having another surge in deaths as horrific as we saw over the summer. I mean, over the winter, excuse me. So New Jersey is seeing a significant decline. Now, I understand that this decline was because of reporting issues, but they have seen actual declines. So really good news because New Jersey never quite recovered from their winter surge, as you can see. It remained high, and then they saw a mini surge here, and then now they're finally recovering from that. Texas, their numbers remain good. So that's really good news. A lot of folks said that they might see an increase because of the relaxation of their mask mandate. We haven't seen that. So that's positive news. That really is. California continues to do extraordinarily well. Colorado is now finally recovering from their surge, although there's some hot spots in the southwestern part of the state. These are very rural areas. But again, they seem to continue to do well. Oregon is recovering from their surge, as is Washington. So overall, the US, positive news. This is data on reopening. So most states are now fully reopened. with little or no restrictions. We know Utah is now, but you can see, but there's a few states that are still being very, very careful. New York, Michigan, Ohio, Kentucky, Illinois, and the West Coast are still being very cautious. I know California has set a date contingent on local transmission levels at a certain level, okay, which is smart. But a lot of states have fully reopened. Is this justified? I'll talk about this a little bit. There's a lot of disagreement even among epidemiologists right now. And just a preview, a little bit of what I'm going to talk about. In some ways, for public health, this is probably the most challenging part of the pandemic. Not when numbers were going up. That was challenging for another reason. But this is really challenging because, well, it seems like any decision we make is going to be criticized. And we're never going to make anybody happy. I'll get to that in a bit. Let's talk about vaccinations in the US. About 160.2 million people have received one or both doses of the vaccine. So we are now approaching 50% of the entire population of the US with at least one dose. It's good news, given that, of course, we still can't vaccinate 12 and under. Okay, so about out of 280 eligible, about 126 million. So of those eligible, we're about 60%. So that's good news. We're seeing, as far as reported doses per day, we're seeing a little bit of an increase here in the last few days, probably because of the 12 to 15-year-olds now that are now being vaccinated. So a lot of folks are rushing out to get their teens and preteens vaccinated. So that's probably resulted in a little bit of a surge. So that's good news. We may see continuous little surge for a few days, and my guess is we're going to start dropping off again. Not every family that was not every parent who was vaccinated is going to vaccinate their 12 to 15-year-old. There's a little bit of reluctancy there, which makes sense, again, given that there are kids. There are some folks who are a little bit more cautious. They want a little bit more time. So I don't see every parent that was vaccinated getting their 12 to 15-year-olds vaccinated. I think a high number of them will, but not all of them. So at our current pace, when can we expect this mythical herd immunity? Right now at this rate, about October 20th. So that's actually an improvement over last week. Last week it was August 20th. Last week it was August 27th, so that's an improvement. And this is equal to those 12 and older, so about 85%, October 22nd. So the rate has increased a little bit, so that date has moved up. We'll see how it goes. This is a very, it just depends on how quickly we're vaccinating. Right now, we're not vaccinating very quickly. So as far as states are concerned, this is what I said. Idaho and Wyoming seems to just not want to vaccinate. Same with the Deep South, particularly Mississippi, Alabama, Louisiana, and Tennessee. These are the states that have the highest levels of hesitancy and the lowest rates of vaccination. And this is why I'm concerned. If we have surges, where will they be? We're entering into a period, even if some of the country has, high enough levels of vaccination where you're not going to get much disease. If we have outbreaks, it's going to be very, very localized. Particularly this winter, we will probably have surges in the winter. Not nearly as bad as earlier on in the pandemic, but we will have surges. We just have to get used to that. And the surges are going to happen in states where they have very low levels of vaccination. So we're going to see surges in the South, as well as Idaho and Wyoming. Okay, and even within those states, probably in rural areas that have very, very low levels of vaccination. That's what we're looking at right now. And again, this is by county, and you can see by county the places that have really, really low levels. And even in Utah, we have some issues with our rural counties. But look at the South here. There's just very little vaccination in the South. Louisiana, Mississippi, Alabama, Tennessee have really low levels. Really concerning. Same with Missouri. parts of Texas. On the flip side, the West Coast has done a really good job. The upper Midwest is vaccinated at high level. Same with the Northeast. Maine, New Hampshire, Vermont have some of the highest levels of vaccination now. I'll get to those in detail. Here's that cool little graph. You can see the South is really struggling, much lower than the average. Same with Idaho, Wyoming. Utah, again, I think we are kind of hampered by our very young population. So yes, we are behind, but we also have by far the youngest population in the US. So, that's what's hampering us. Even so, I think, this kind of it's a little bit of, it actually kind of misinterprets how good we are doing. I think we are doing okay. Not as well as we could be, but we're doing better than the national data set tells us, because again, we have a younger population. Here it is by states. So you can, what I want, the takeaway here is that you have states like Vermont at 66% given at least one shot of the total population. That's really, really great. Then you have Mississippi at 33%, literally half the rate. It's some significant disparities. Significant disparities. You got Vermont, Hawaii, Massachusetts, New Hampshire, Connecticut, Maine, Rhode Island. Seems to be an interesting trend. Not so interesting, right? These are all states that voted for President Biden. Meanwhile, you look at the bottom there: Mississippi, Louisiana, Alabama, Wyoming, Idaho, Tennessee, Arkansas, Georgia, with the exception of Georgia, all these are states that voted for President Trump. Former President Trump, excuse me. God, jeez. Utah's actually not doing bad. Utah's actually moving up this list. As eligibility opened up for everyone, Utah quickly moved up on this list. Again, indicating that we have a much higher proportion of our population ages 12 and under, which means that they're not eligible. Okay, so it's always going to kind of, bias Utah lower. But anyways, yeah, this is extraordinary. I mean, at 66% of Vermont, yes, Vermont's a tiny state with very few people, but still pretty extraordinary. Then you have Massachusetts, which is a much bigger state. Same with New Jersey, Pennsylvania, and they're doing far better than places like Mississippi and Louisiana. And this is a concern because, again, we're going to have hotspots in those areas that have low levels of vaccination. Yeah. So, far as rate of vaccination, Hawaii is still going great. What's amazing is Vermont, even though they have such a high percentage of their population vaccinated, they're still vaccinating almost a person per 100 per day. So 1% of their population per day is getting a dose. That's extraordinary. So Vermont, Maryland, Washington, so these states that have a higher level are still continuing to vaccinate at a high level. So Massachusetts, Connecticut, Maine, California, New Jersey, yeah, all these states are still continuing to vaccinate at a high level. Meanwhile, North Dakota has really slowed down. Mississippi, even though they're only at 30%, 33%, they're just not vaccinating anybody. Those states right now, they'll be lucky after it's all said and done to have vaccinated 50% of their population. Far below this mythical herd immunity level. And that's really concerning. I mean, you're looking at only 33% of their population with one dose, and they're vaccinating this slowly. I really don't see, I'd be shocked if they got over 50%. And yes, we may, as a country, reach this mythical herd immunity. But with herd immunity, you have to look at local. Okay, we can't assume that, okay, we reach 80% as a country. That means if that remaining 20% that doesn't get vaccinated is dispersed randomly through the country, then yes, maybe we establish herd immunity and COVID cannot transmit and it goes away. However, that's a really, really, really tough assumption to make. Right now, we know that people who don't get vaccinated are clustered, rural areas that voted for Trump. And therefore, even if we do reach 80% as a country, it's not going to matter. as long as we have clusters of folks with high numbers of people who are unvaccinated. And that's what we're looking at right now. So, yeah. As far as shares, Vermont's number one, 66%, phenomenal. Mississippi down at the bottom at 33%, literally half, less than half the rate, the percentage in Vermont. Hawaii's done really well. So we're looking at Vermont is quickly reaching that level where you're going to see really low transmission, maybe none. Hawaii too. Connecticut, Maine, New Jersey. So these are states that are doing really well. Utah, by the way, is doing okay. It's doing okay. Again, it's a little biased, a little low because of our young population. But boy, Tennessee, Georgia, Mississippi, West Virginia. West Virginia is really shocking because they were doing so well earlier on. And if you break it down, their vaccination of their senior population has been really good. It's the younger populations that are really not being reached. As far as fully vaccinated, Maine is number one, Connecticut, Massachusetts, New Jersey. And again, these are also states that are still continuing to vaccinate at a high level. I would say in the next few months, they're going to reach a position where they're going to have very little transmission of COVID, where if we see surges, they're going to see very little surge or none at all because their populations are so fully vaccinated. Mississippi, on the other hand, boy, they're just struggling. And yeah, just saw this on Vox. South could still become summertime COVID-19 hotspot. Not even talking about fall, but summer. Yeah. I would not be surprised to see surges in the summer. And again, this is also a region that is most susceptible to hurricanes too. So as far as social justice issues, we still struggle with this. The counties that have the least amount of social vulnerability are the most likely to be vaccinated. Now, there's some interesting confounder here, and that is political stance. So a lot of these most vulnerable are also very much more likely to vote Republican, which is also less likely to believe in masks and vaccinations and so on. So that's an interesting confounder here. But yeah, we need to do a better job of reaching our most vulnerable population. At the same time, if they don't want to get vaccinated, there's only so much we can do. This is how politics has really poisoned this pandemic. As far as racial progress, so this is an interesting graph. So this gray is the percentage of the state population that is African American. Okay. Now this green one, dark green one, is the percentage of the population that is vaccinated. So the percentage of the African American population is vaccinated as of May. The light green is as of March. So in many states, we're making progress, but we're not quite there yet. Okay, if that dark green is next to that gray, that means we're vaccinating the African American population at the same rate as whites, but I don't see that as the case in any state right now on this list. Maybe, no, not even Utah. Notice Utah has the smallest percentage of African Americans, and yeah, but yeah, none of these states are we even close. Maybe Massachusetts, Mississippi is doing an okay job actually, but otherwise, yeah, we're struggling. Florida, look at this. We haven't made much progress at all in Florida. Now, this is for Hispanic population. Same thing here. So New Mexico, yeah, let's see. New York's done a good job, same with Florida, reaching Hispanic populations. Virginia actually is interesting. They've actually vaccinated more of their Hispanic population than their white population. That's really positive. And Iowa's done a really good job. Missouri as well. So we've done a better job reaching Hispanic populations. But again, more work needs to be done, particularly in some of these states like Colorado, Arizona, California. We still need to do a lot more outreach and a lot lot more work to reach these populations. So you can see this is the rate of vaccinations per day. Looks like for Asians and Hispanics, we are doing we're vaccinating those populations at a higher rate right now than other populations. But African American populations, we need to do a better job reaching these populations. Now, some of this is also altered by the fact, same reason why Utah numbers may be kind of distorted. It's because particularly with Hispanic and African American population, it's a younger population. So they became eligible for the vaccine later. So that could explain a little bit of this, particularly with the Hispanic population. It could explain why a smaller amount of the Hispanic population is vaccinated right now, because it was a later start, because the eligibility, they weren't eligible because they're a younger population. So keep that in mind as well. But we have no excuse now because, well, we do, because again, the under 12 population, yeah, if you look at Hispanics, yeah, much bigger part of the Hispanic population is under 12, and therefore not eligible yet. One bit of news from Moderna and Pfizer, both the CEOs say that we may need that. Again, we'll know more as we continue to gather data about the long-term efficacy of the vaccines, but they're saying that perhaps 6 months, you may want to get a booster. So that means in the fall, those folks who got vaccinated early may want to get a booster. I don't necessarily think this is a bad thing. I think we need to start preparing for the fact that we're going to have to live with COVID, and we may need boosters to enhance our immune response. I don't think that's a bad thing. Plus, these boosters can be tailored to the variants. Although I am not concerned about variants. And I'll tell you why in a bit. So let's talk about Utah real quick. There's not much to say about Utah. We continue to trend downward, slowly, but still trend downward. You can see this, as far as the numbers here by county, we still have some little tiny surges in the rural areas, but for the most part, the Wasatch Front continues to do well. Tooele's seen a bit of an increase. That's a little bit of a concern. But otherwise, the rest of the Wasatch Front continues to do well. Yeah, the surges here you can see from a per capita standpoint are in rural counties. Again, unstable because of low populations. Uinta, Millard, Tooele, Emory, those are the places that you're seeing a surge. But again, not huge amounts. So Utah continues to do well in terms of numbers. Our test positivity remains the same, but our testing numbers are going down, which is again, I get concerned about that. One thing that's a little bit of an interesting blip is a slight increase in hospitalizations in recent days. Don't know what that's about, but it's something that I noticed. It's a little bit concerning. So you can see that, yeah, ICU utilization is kind of trending up a little bit. Now, so this is ICU utilization, not necessarily so for patients with COVID-19. So I don't know. I don't know what to read into that. Maybe it's just a blip in the data. Maybe it'll continue going down. That's a bit of a concern. As far as vaccinations, notice in Utah, you don't see as much of a decline in vaccination as other states. We're staying kind of steady. And that could be because, again, after we open things up to 12 to 15-year-olds, that, a lot of families are going to get them vaccinated because our share of 12 to 16, as a percentage of the population, we have a much bigger share. So we're staying kind of steady, which is promising. So we are now at 43% of our entire population receiving at least one dose. But as a population, as a percentage of eligible, we're 55% of eligible. So over 12, we're at 55%. So that's good. Okay, percentage, but again, as a percentage of all Utahns, it's a little bit lower because again, we have a much younger population. And this is by county. Again, I want to show you the vast disparities. Summit County at almost 50%, all ages, 63% over the age of 18. So that's really good. But then you have look at Juab County, and this very, very low. Some of our rural populations are just not getting vaccinated. Whether that is due to accessibility issues, because that's a challenge that's fairly unique to Utah that maybe Massachusetts doesn't have, or whether it's because of vaccine hesitancy. It's probably a combination of both. But I think we in Utah have to get a little bit more creative about reaching some of these hard to reach populations. So you can see that vaccine administrators, we're actually kind of staying level here. We're not dropping so much. So we kind of stabilized, and that's really promising. Maybe even see an increase as the 12 to 15-year-olds start to get vaccinated. That would really be promising to see. But Utah is not quite as bad as the Deep South or Idaho and Wyoming in terms of hesitancy. Will we see the level of vaccination as we see in the New England states? I don't know about that, but I don't think we'll be as bad. Well, I don't think we'll be the worst, which is not a great bar, I know, but trying. So you can see that, yeah, this slope has really kind of slacked off. Hopefully that changes a little bit in the coming weeks with 12 to 15-year-olds. And again, the ages that are least likely to get vaccinated, and this is true with every state, are the younger populations. So that political dimension isn't necessarily explaining all of it, some of it, because you think about older populations, they're much more likely to vote conservative Republican, yet they have by far the highest rates of vaccination. Younger folks who typically vote Democratic have the lowest level. So that doesn't explain all of it. So that's the danger of just saying, oh, they voted for Trump, they're less likely to get vaccinated. That's not necessarily true. Then by ethnicity in Utah, race, ethnicity, we have a long ways to go in Utah. We're just not reaching these populations. Okay, couple of things. I mentioned that this is probably the most challenging part for public health practitioners because we're at a point where, look, number one, we're going to have, COVID's going to be a part of our lives. Bottom line. It's not going to get eradicated. It's not. We've only eradicated one disease in our history, and that's smallpox. And smallpox or COVID are very different diseases in terms of eradication. It just, there's aspects of COVID that is going to make it really difficult to eradicate. So it's within the next few years, it's going to probably become like the flu. We'll have surges, but they're not going to be nearly as deadly. It's not going to shut down, it's not going to shut down countries. It's just something that is going to happen. It's going to be surges. People will die from it, but it won't be nearly as bad. So we're going to have to learn to live with it. Okay. It's not going to go away. The problem is everyone right now, we're trying to open things up, but everyone has a different threshold, different risk assessment. And to me, the CDC announcing that masks won't be required for people with a vaccination indoors is an example of how this just blew up. And it's really, I take a much more academic approach to this and just kind of am interested in the reactions. And it is interesting. So, and this didn't make anyone happy, it seems, except maybe for those folks who really want to get rid of their mask. But there are some folks who are on the more cautious side that are really, really concerned, really, really angry about this, which is really, really, and this is going to be a really precarious time to navigate. I'll tell you a very anecdotal story. My wife and I were talking about finally having our housewarming party and trying to determine, okay, who are we going to invite and what are the conditions? And even that was fraught with uncertainty because, okay, if you're vaccinated, then come on in, no masks are required. If you're not vaccinated, then please wear a mask. indoors at least. And we realized, well, that's going to piss off people who don't want to wear a mask, which we don't have a lot of people. We don't know a lot of people like that, but there's a few. But it's also going to not, it's going to piss off folks who are really super cautious, saying you're actually inviting people who aren't vaccinated, even if they wear a mask. So that's kind of the conundrum we're in. And this is it kind of, to me, encompasses the entire conundrum in the entire country. We do need to get back to normal. But what the hell at what point do we do that? I don't necessarily agree with the CDC's recommendations. I think it's too early in some ways. But at the same time, the data coming out of Israel shows that if you are vaccinated, it's even more effective than the clinical trials show us. So this is going to be really interesting right now, how we navigate this kind of gray area. And in fact, we're talking about it with the campus right now. What are we going to do in the fall? Are we going to require masks in the classroom? It'll be interesting to see. Yeah. And this is, like I said, this is why it's precarious, because everyone has a different level of safety. This is just going to piss everyone off. And this is where, boy, this is where public health gets really, really tough. Now, note on variants. So I haven't been talking a lot about variants. And quite honestly, last few weeks, everybody's been concerned about variants. Everybody was really worried about variants, and like the variants are going to just come around and just kill us all. And I could not get worked up about it. I couldn't get that level of concern that some other people had. And I was just like, why aren't they concerned? I should be concerned. I want to be concerned, but I just can't. And I trust my instincts. And then I found this article, this is out of MIT, saying why we don't need to panic about the variants. And this kind of covered why I wasn't concerned about variants as much. Okay, I just could not get concerned about it. A few reasons. Number one, so these are some of the quotes from some virologists they talked to for this article. The virus hasn't fundamentally changed. And it's true. Yes, there's a few mutations. It's like it's slightly more efficient at transmission. The data on deadliness is still kind of, we don't know. There's some data that said maybe it's more serious, but the data is not clear. But fundamentally, the disease is still the same. It really is. And I don't think there's an imminent danger that we're going back to square one. We should be concerned, but not freaked out. Yes, concerned, but not freaked out. And there's a lot of freak out, even in the public health community. And here's the reason why. Number one, all evidence, and there's some really good evidence now, I can go over it, but I don't have time, that the vaccines work, even on variants. Maybe slightly less effective, but they work. B117, B1351, P1, now the B617, B1617, the vaccines seem to work on all of them. Okay, maybe some evidence that's slightly less efficient, okay, depending on the vaccine. But that's where having multiple vaccines, multiple technologies is going to be really, really one of, they're going to have varying efficacies. So having all of these is a real positive. Okay, so vaccines work. So that's one thing. It's like, well, B117, we're so concerned about it, and that's a predominant strain in the UK, but look at UK numbers. B357 and B117 in Israel. Look at Israel's numbers. It seems to work. They work. The immune response is really robust for these vaccines. And the vaccines, regardless of the variant, regardless of whether you get a breakthrough response, it's still effective against the worst outcomes, hospitalizations and death. Even if you get COVID, chances are you can stay home, get through the symptoms, which will probably be much milder. That's that. And here's the big one to me. And this is a little bit nerdy. And maybe, Chris, you can comment on it as well. The same mutations keep popping up. Now, when we talk about variants, the variants mean that these are lineages. Okay, they're basically lineages that we can trace to like one. So one person gets this one variant and then it starts spreading. Mutations are the actual mutations in the genome that causes the spike protein to be a little bit different. Okay, here's the thing. The same mutations keep popping up in different lineages independently. So if the mutation just follows the lineage, that's just basically, natural selection, and it just follows the lineage. However, the same mutations keep popping up in different lineages, means they actually evolved independently. But it's the same ones. For example, the EEC mutation is in several of the variants. They all popped up independently. So that is a concept called convergent evolution. And to me, this is good news. It means that there's only so many mutations that could occur in this virus. And they all seem to be it's already happened. I don't know if there's any other mutations that can occur that turns COVID into this super death virus that's going to kill us all. Because the same mutations keep popping up in different lineages independently. I personally think that's really good news. If you think about the SARS-CoV-2 virus, it's a relatively simple virus. And already we've had mutations on the spike protein, which is the most concerning, but they just seem to be the same mutations that occur constantly. I don't know if it's possible for SARS-CoV-2 to evolve into something other than it already is, which is really good news. Anyways, and finally, booster shots are easy to develop and effective. Already, Moderna has developed an initial booster against B117. No, actually, they didn't even do one for B117 because the regular vaccine is perfectly fine at killing it, at protecting against it. This one's for B13051 and P1, and it's highly effective, at least in an immunological sense. Okay, we haven't seen this in human-based studies, but in immunological studies, highly effective against those variants. So it's easy to come up with boosters. It's very easy to develop. We've already developed one for variants. So we can, if variants do pop up, boom, we get a booster. So, this is a concern, of course, for places that don't have access to the booster. That is an issue. But this is why, look, yes, variants occur. It's going to occur. We knew it was going to occur. But yeah, we have these variants, and we just, if you kind of take the 30,000-foot view of them, they're not that much different. They're not causing, yes, maybe slight increases in transmissibility. Again, the data on how deadly it is still kind of being worked out, but I don't see hugely compelling data that it's any more deadly. So are we getting worked up over really nothing with these variants? I don't know. Again, this is something that a lot of folks would probably disagree with me. That's fine. Yeah, interesting article. I can post it if you're interested in reading it. It's in the MIT Technology Review, which isn't a medical journal, but I thought it was really interesting. And it just kind of, it just kind of confirmed why I've been trying to get worked up about the variants, because that's what we should do as epidemiologists, I guess. But then again, my approach is a lot of public health folks like to take the worst case scenario and protect against that. I don't think that's necessarily a good approach for public health. to prepare for and try to basically be the naysayer, basically be as pessimistic as possible. Some public health folks think that that's their job. I think that's ultimately incredibly destructive. So maybe that's part of it. But I just could not get worked up over variants. And this is why. I think this kind of elucidated exactly why I could not get worked up over it. Chris, you want to make any comments on that? Or
Yeah, sure. Can you hear me okay?
Yeah.
Yeah, I agree that we don't need to be, panicked or overly concerned about the variants. But I think it's another example of having to walk a fine line between the reality and not, overhyping a situation. Because the variants and the possible variants that may arise remain our biggest possible hurdle to,
Right.
Normal as we pursue that. And people not getting vaccinated and not wearing masks makes that hurdle potentially bigger and bigger, possibly nothing. And the variants that are out there right now, as you already mentioned, not overly concerning.
Yeah.
So we don't need to panic, but we just need to continue watching them, continue studying them. And I think they should be used as a point to push people to get vaccinated and continue to wear masks without scaring them by doing so.
Yeah. Thanks for that, Chris. So yeah, I think this also epitomizes my previous point about where's that line for public health. We don't want to panic people. And I think a lot of folks in public health think that's our job, to just communicate the worst. And I think that's ultimately really, really destructive, that it basically erodes confidence in public health. But at the same time, if we aren't careful enough, then it can make things worse. So it's a really, really fine line. And we're right there. We're at that point where we've got to make these decisions where we're really trying to straddle that line. So, and this is another, again, we don't want to freak people out about the variants and scare people, but at the same time, we want to, as I say this, another variant could be discovered that has that super mutation. So it's that fine line that we have to straddle. Chris.
Yeah, sorry, just thought of another point. In addition to, folks in public health possibly causing undue concern, there's virologists doing the same. There's one virologist here at A&M who attempted to identify a variant from a single case, which is very silly, but then also tried to name it Brazos Valley 1, which is the area of Texas that we live in. So A, we're not supposed to name any of these viruses or variants after locations, but B, a single case trying to say that that's a variant of concern, that's not warranted at all.
No, not at all. Remember, mutations occur all the time. The vast majority of them don't do anything. So yeah.
It seems like a quick way to get 5 minutes of fame, but I think trying to call everything a variant just causes that undue concern and waters down the important message.
Well, and I would also argue this is the problem with publications and the way we practice science, that publications want something unique. And so we go and find stuff. It just almost forces us to find these random things just to get published, just to get tenure. And I don't want to go down that. I don't want to go down that rabbit hole because I'll rant for a while. So, all right. So yeah, I think on that note, I already went over again. I had more to share. These studies. Again, I want to really go over these studies. It's just run out of time. Some of these studies out of the study out of Qatar, a couple of studies out of Israel. Now there's another study out of the US, just kind of reaffirming how effective the Pfizer vaccine is, and kind of justifying this policy that people who are vaccinated, it's safe to be indoors. Of course, the issue with that is not the efficacy of the Pfizer vaccine and protection for those who are vaccinated. It's the fact that we have no idea who's actually vaccinated. And that's the big issue. But maybe I'll go over that in another recording. Now, I will post this hopefully in the next few hours on my new YouTube channel called, what did I call it? Oh, yeah. No, I won't look at your mole. That's the title of my YouTube channel. I will put this one on, and last week's, and then from this point on, I will put on the brown bags on that channel so that folks can actually access it. I might actually put in some bonus materials on that as well, like for example, my reviews of these studies. So it might just become my general YouTube channel. So, but thank you again for attending. I appreciate it. I will be back next week because there's always news, always stuff to go over. And in the meantime, if you have people who want to access it, I will share the YouTube channel so people can access it. Otherwise, it's also on my Facebook. So, right. Have a good weekend. And hopefully I'll see most of you next week. See you later.
Thank you, Chris. Thank
You're
you,
welcome.
Han. Thank you, Han. Bye-bye.
We'll see you later.
Yeah.
Bye.